Terrific. Well, thanks everybody for joining in. It's certainly been a little while since our last session. Really excited to see everybody here, and a huge thanks, Dr. Lulich, for leading today's session. As always, we certainly encourage this to be a collaborative and discussion type of presentation. So we encourage everyone to ask questions and to participate. You can do that through the chat, or you can turn on your microphone. Please keep your microphone muted if you are not actively asking a question. And otherwise, we will turn it over to Dr. Lulich to get started again. Thanks so much for getting us back on track. It's been a while. And Dr. Lulich is presenting on decompressive cystocentesis. So thanks again, Dr. Lulich.
Great. Well, it's also wonderful to meet everybody, and I'll be there at ACVIM, so hopefully I will reacquaint myself with my old colleagues and hopefully reintroduce myself to new ones. What I wanted to do is I want to talk about an article that came out, I don't know when it came out, maybe about 8 months ago. So we're going to talk about multi-center evaluation of decompressive cystocentesis and the treatment of cats with urethral obstruction. You probably want to know why should we evaluate this article, and several reasons why. Number one is that many people come to me and want to know what I think of this article. Some people show me this article to prove that cystocentesis isn't necessary, and when I read it, I just took a different take on it. The other reason why is because I was watching a webinar in January, and they said 10 takeaways from veterinarians in 2021, and they actually mentioned this article. And again, maybe I'm not thinking the same way that they are, so it's really important that we do get discussion. And the last thing is just recently it showed up in clinical briefs, and it was entitled "Under Pressure: Cystocentesis in Cats with Urethral Obstruction." Again, I had a little bit different take, but they said that cystocentesis was okay as long as it was performed by trained people. They also, the other point was, is although decompressive cystocentesis appeared safe, it didn't affect the time or ease of catheterization. And they also said that it did not result in any improvement of metabolic derangements. So what we're going to do is we're going to look at all of those and maybe assess it after we talk about the article. So how are we going to evaluate this article? Well, I'm going to do it two ways. One is I'm going to use the user's guide to the medical literature. You may have seen this before. And I'm going to focus on items 2 and 3, meaning how are the subjects being evaluated and assigned, and do the outcome measures address the aims and the hypothesis. The other thing I'm going to do is I'm going to use audience consensus. If you want to, you can hook that into your computer now. But I have actually 4 questions where you get to participate, but there'll be a link on the slide when I actually do that as well. Well, if there's no questions or comments, let's go ahead and get started. Again, I wanted to evaluate this article just because I wanted to make sure that my interpretation agrees with the group. To give you a little bit of background, decompressive cystocentesis prior to urethral catheterization has been proposed as a safe and advantageous treatment for cats. And the benefits are that you get a clean urine sample for analysis and culture, you reduce bladder pain, decrease renal back pressures to facilitate metabolic stabilization, improve urinary bladder wall perfusion, and facilitate retrograde urohydropropulsion and subsequent urinary catheterization. And that was in their introduction as well. Now, there's several things I like about this study. Again, it was a randomized study, so they did blocks of 10. They were blinded, at least the providers were, and I also think the cat parents were as well. They did do a clinical trial that was well balanced, 44 in each group, and cats had spontaneous disease. So I thought that was really important. Their hypothesis, again, was decompressive cystocentesis will ease urethral catheterization and decrease the time for urinary urethral catheterization and is safe. They really had 4 aims, and that was the time to catheterize the urinary bladder, the ease of catheterization, the change in the amount and location of pericystic fluid, and the outcome of resolutions of metabolic derangements, recurrent obstruction, death, visible hematuria, and inappropriate urination. I'm not going to focus on all of them. I'm really going to focus really only on 2. And I looked at their discussion, and they had 2 conclusions. And those conclusions were performing decompressive cystocentesis prior to urethral catheterization was not found to improve ease of urethral catheterization or the time to place the urinary catheter in cats with urethral obstruction. We're going to take a close look at that. And the second one we're also going to look at is relieving pressures earlier within the urinary tract by performing decompressive cystocentesis did not affect resolution of metabolic arrangements. You'll notice that I have quotations around there because I don't want to misquote any of the authors who did this study. I want to use their exact words. Let's go ahead and get started with the first one. So the first conclusion that they make is that it was to improve the ease of urethral catheterization and the time for catheter placement. In order for us to evaluate this a little bit better, what we need to do is look at the materials and methods. Now, that's a lot for you to read, so that's not my goal for you to read that. Let me just go ahead and tell you that what they did is they scored ease of catheterization from 0 to 4. What I've done is I've outlined them here. 0 is passage of a catheter only. 1 is passage plus 1 or 2 flushes. 2 would be multiple passage with greater than 2 flushes. Difficult with greater than 2 flushes, and the inability to pass a catheter. What I'm going to do now is I'm going to use your help and solicit your response. I'm going to first tell you the question, and then I'm going to redirect you to another spot. The ability to push a catheter through the urethra, which is their number 01 in the bladder of an obstructed cat, depends on what? The intraluminal pressure, the intravesicular pressure, or both. What I need to do now is, if you just give me some time, I'm going to go ahead and steer you over to this question right here. And the question is actually open already. What you can do is you just need to go up here and hit that link, and it should put you into Chime 2. And then you need to enter the code 218441. And then once you're online, it should say that participants are connected, and you should be able to see a chart that will put you in there. So hopefully you can get in there. I don't see anyone connected. Great. So now other participants are connecting. I see that 2. The rest of you should be able to connect as well. Once you do connect, you can respond. What I'm going to do is I'm not going to review the results until I see a little bit more responses, and then I'll go ahead and review the results. If you're having difficulty getting in, let me know. I may have to do other ways to do this, but the good news is I see people now entering quite readily. For those of you who don't want to participate, it's not a problem at all. I'm not sure I have the right answer, but hopefully through our discussion and participation that we'll be able to get the right answer. I'll give you just another maybe 20 or 30 seconds or so, maybe 20 seconds or so, and then we'll review the results and discuss them. And then maybe for those who chose different answers, we can actually talk about why you chose what they did. I'm going to go and let you review the results. If you want to, you can still go ahead and look at it. So some people just say intraluminal urethral obstruction, and some people say both. No one is saying intravascular bladder pressure by itself. What I'm curious about is if anyone wants to open their mic and tell me why you chose what you chose. If anyone wants to do that. You don't have to, but it would be great if you did. A lot of people chose both, so I'm really curious under what circumstances you would make that decision. No one wants to open up their mic. Great. Okay. Well, at least we see the responses here, so you know what's going on. If no one wants to talk about it, it looks like someone is opening their mic. Anyone wants to say anything? Why did you say both? I don't hear anybody. Okay, let me just go ahead and go back to the talk. Great. Great. So the question is, would bladder pressure influence the method of catheterization? And maybe it depends upon which one. So if I think you're just going to pass a catheter through the urethra, I really don't think that bladder pressure has any influence on it whatsoever. Because if you're just pushing it through the urethra, it's really going to be all the urethral tone. An example would be is if you're pushing it through the urethra, what you're really doing is dealing with the intraluminal pressure within the urethra if you're just going to pass a urinary catheter. An example would be this one right here. This cat has a plug within its urethra. And believe it or not, if you look a little bit further down, the urethra actually is probably going to be a little bit more open, so it may make it a little bit easier. But my recollection is that passing the catheter through the urethra would not have, the intraluminal bladder pressure wouldn't have any effect on it at all. Certainly for those of you who wanted to choose both, or if you choose something different, we can open your mic now, or we can certainly do it at the end as well.
I guess, I chose both. I agree with you there. In a normal anatomy and without inflammation and without grit and debris, I think what you're suggesting makes perfect sense. I chose both because I consider the amount of kind of back flushing of some of that grit and debris that I always flush. I don't try and just insert the catheter without some amount of flush, just to try and be less traumatic to the urethra. So I was taking that in consideration when I chose both there.
Great. So what I'm going to do now, so I appreciate you saying that. And what I'm going to do now is I'm going to go to the next question because it actually asks that. So it says the ability to retrograde flush the urethra in an obstructed cat depends on certain things. So what I'm going to do now is I'm going to go back to our electronic display, and I'm going to close this question and open up the next one. I'm going to hide the results. So now you get to respond to this one. So the first one just asked about pushing the catheter through the urethra, which was one of their most common ways of doing it, and that was the only one. So now we'll ask this one and see if we can get a response. Looks like we have 17 connected to chime in. Looks like I have 8 or 9 responses already. So maybe what I needed to do is I needed to address that question better. I'm going to go ahead and show you the results. So now most people are saying both. And now I understand the reason why. And certainly it may make sense if you're going to flush. So what I'm going to do now is we're going to go back to the other one. I'm going to go ahead and close this question unless anyone wants to answer that. And then let's just go back to our talk again, and we'll look a little bit further. Great. So what I'm going to say is that it really depends upon how you retrograde flush. So if you're just going to flush without urethral occlusion, again, I'm going to say the same thing, and that is that probably the intraluminal pressure or intravesicular pressure is not going to affect your flushing at all. However, if you're going to occlude the urethra and flush, then it is likely that the back pressure would be included in with the intraluminal pressure. There was one person who just said the urethral pressure only, and maybe it depended upon the method in which they were flushing. And so that's what that paper doesn't describe. It really doesn't describe their method of flushing. So when we talk about scores of 1, 2, 3, 4, and 5, I'm going to say possible, but is also caused by the depth of anesthesia. When I say 2, it's also possible by the depth of anesthesia. And when they get down to 4, inability to pass the urethral catheter, bladder fillness, at least in my mind, really is not going to affect you being able to flush or pass the catheter. It's really going to be more the underlying disease. And so that's really important with that paper, thinking through how they did that. So what factors influence the ability to push a urethral catheter in an obstructed male cat? And to me, it's mostly going to be intraluminal pressure. So it would be the underlying urethral disease, whether it's a plug, idiopathic, a stone, or extramural compression. It'll also depend upon the depth of anesthesia, the force applied to the catheter, and the method of clearing the urethra before passing the catheter. Let's go back and look at the article. The article did not account for the underlying disease, but it was in their limits in terms of their article. The depth of anesthesia was poorly accounted for. What they actually did was looked at how much medication was given to each animal to anesthetize it, but that isn't reliable in terms of the response, especially since animals who are in more pain would be able to have more of a response, and so it wouldn't really relate to that. The force applied to push the catheter was not accurately accounted for. It was very subjectively made and would probably vary by the operator. And the method of clearing the urethra before passing the catheter was poorly documented. It didn't mention any of the things that I thought were really important to know, even how this urethra was flushed. So I'm not sure that we can really read the paper very objectively. Let's look at our second question. What factors influence the ability of to retrograde flush the urethra in an obstructed cat? And again, it's going to be intraluminal and intravesicular pressures, depending upon your method. Now let's go back and evaluate the paper. It'll certainly depend upon the underlying disease, but that was not accounted for in this paper. We've already talked about the depth of anesthesia. They didn't talk about the method of flushing. It was poorly documented. They just said that they flushed the urethra, but they didn't give things like the volume of fluid that was flushed. They also didn't give the force to flush the fluid. That was not provided. And depending upon whether they're going to obstruct the urethra or not, you're probably familiar with the law of Laplace, which is the power paradox, that pressure is inversely related to radius. So if they used a very small syringe and they didn't give us any idea of syringe size to actually flush, it would be much easier than if you used a larger syringe. As we go further through their themes, the intravesicular pressure or bladder fullness or distensibility was also poorly accounted for. In fact, I was amazed for an entire paper that talked about decompressive cystocentesis. Nowhere in the paper was reported the size of the bladder if decompressive cystocentesis was necessary. What they did talk about was how much fluid was removed, either with urethral catheterization or decompressive cystocentesis. But they also subjectively measured bladder size. And in this paper, they also did ultrasound, but nowhere did they talk about bladder size. But even if they did, what we need to realize is that the bladder actually goes under a system called compliance, which means when the bladder is feeling, there's a large portion there in which intravesicular pressure changes very little while the bladder fills. So if we're talking about pressure, again, I'm not sure that this study was well thought through in terms of what the bladder can do. Another question you have to ask yourself is the obstructed bladder different from an unobstructed bladder? And according to these studies, the answer is yes, but most of them were done on animals that weren't cats. This study does mention cats, but I couldn't find it anywhere in any of their references. And what this says is it depends upon whether or not animals develop hypertrophy or not hypertrophy, how compliance changes, but compliance is still part of it. Now, when we look at their results, of course, they said that there was no difference at all. But again, there were many variables that should have been controlled that weren't controlled for. Now, one of the things that I thought about that they did in this study is that they would actually push the catheter through the urethra without knowing the underlying cause or knowing the underlying disease. And so I'm going to give you some examples here where that is certainly a doable thing, but in my mind, it's probably not the best thing to do. I always ask, are my people who unobstruct cats, are they flushers or pushers? And I always think that pushing can end up with a lot of trauma. I wonder if you can look at this radiograph really well and tell me the underlying cause. Because if you look really good, you'll be able to see it. It's right there. It's actually a stone. So you can imagine that if they push the catheter past the stone, that may have caused additional trauma to the urethra, and certainly pulling the catheter out would cause more trauma as way on the way out. Can you see the cause of this animal, why he's obstructed? Well, if you look really closely, it's also a stone. So I can tell that this veterinarian is also a pusher instead of an initial flusher. And of course, this one is quite obvious to know actually how this catheter was introduced, and it was probably pushed instead of flushed. And so my recommendation is, even though that was recommended in that, and it's certainly possible to do that in certain patients, I think urethra should be flushed clear before you actually pass a urethral catheter. Now that I've talked about the first conclusion, unless anyone wants to comment on anything, what we should do is look at the next conclusion. The next conclusion was relieving pressures earlier within the urinary tract by performing decompressive cystocentesis did not affect resolution of metabolic derangements. I'm going to ask for your help again. Question 3 is, to assess the ability of decompressive cystocentesis to facilitate metabolic derangements, study cats should be metabolically abnormal. Do you agree or not? What I'm going to do is go back and open up the next question. So we'll go here. I'm going to go ahead and close this question. I'll open up the next question. And I think the question is open already. Open the question. There you go. So now you have the question. I'm going to hide the results, but you can say either it's true or false. I'll give you time to respond there. To assess the ability of decompressive cystocentesis to facilitate resolution, should all study cats be metabolically abnormal? Looks like I have a little bit, 2/3 of a response. Since this is an easy question, I'll wait a little bit longer. We have 2 more people. If you want to respond, that's great. I'll just wait another 10 seconds or so, and then we'll begin to evaluate this question as well. Great. Let me go ahead and show the results. So some of you said true and some of you said false. So it's really interesting. So I don't know if anyone wants to describe or tell me why you chose either one of those answers. Anyone want to open up their mic and tell me why you definitely think true, or why those who chose false, why you think that more than just those who have study derangement should be included?
Hey, Jody, it's Larry. I
Right.
didn't have the opportunity to vote, but certainly if you're going to assess the ability of it to resolve, it has to be abnormal to begin with. So,
Yeah, that's how I feel as well. That's how I feel, Larry. So I thought it was an interesting study. So now that we have some explanation, let's go back and let's look at this paper to just make a decision to see what they actually did so that we can actually respond appropriately. Again, the conclusion was is that they looked at metabolic resolution of metabolic derangements. What I have on the bottom of this slide here is the median and range on admission. And so you can see that ionized calcium, depending upon the range that you have, may be a little bit lower. But when you look at plasma creatinine as well as serum potassium, they're really within the normal range in terms of the median value. So that tells me that at least, I'm assuming, half of the cats would at least be normal or below the normal value. Now let's look at their results, because they really don't give us any more values in terms of that, but here are their results. No significant were found between cat groups in PCV, blood pH, serum concentration of total protein, plasma ionized calcium, BUN, creatinine, or potassium concentrations at the 8 to 12 hour or the 24-hour time points. And that's a really good observation, so I like those results. However, for me, the author's results don't really result in their conclusions, because their conclusions is that there was no difference in terms of resolving metabolic derangements. And so I thought that was interesting, because for me, it actually diluted out the effect, and so then you wouldn't expect there to be a big change. I'm going to ask one more question of you. Here's the last question. To assess the ability of decompressive cystocentesis and routine therapy, because that's going to be our routine, what we do for our patients is to give them fluids, to facilitate resolution of metabolic arrangements, study cats should be evaluated how often? I'm going to go back and give you an opportunity to respond. I'm going to close this question, go to the next question, open this question. I'll go ahead and hide the results. There's not a right or wrong answer. I'm just curious in terms of how you would respond. So to assess the ability of decompressive cystocentesis, what time frame would you actually like to evaluate your patients? I have half the responses so far. We'll wait just a little bit longer to get a few more. Great. We have a good number here, so I'm going to go ahead and view the results. I'm not sure that there's a right or wrong answer, but certainly we have a variety of answers here. Again, I'm curious why some people would choose one thing over the next in terms of it, based on your experience. I don't think there's anything in the literature. Did anyone want to comment on why they chose what they chose? And there's not a right or wrong answer here. It would depend upon what we're looking for.
I picked 2 hours because you didn't have anything less.
So you want to know right away. Why, I certainly I agree that looking every 2 hours would give you an idea, number one, if there's a trend, so you can make sure that what you're seeing is actually what's actually occurring. And certainly if you expect changes to happen rapidly, or if you're going to institute other therapy, then looking early may be very good. For example, if you're just going to do a decompressive cystocentesis and it takes you maybe another hour or two to get fluid started, then you'll be able to assess what adding an additional therapy on would benefit. So I agree that looking early would certainly be good. Did anyone else want to comment, like why you would look later, and look at the benefits and risks, there's really not a right answer. It's just a matter of benefits and risks. Anyone else want to comment on that? Okay. Well, if not, let me go back to my talk again, and we'll continue to look at these things and begin to talk about them. And I agree. I think looking a little bit earlier to me would have been a little bit better. And the reason why is because my experience is that when cats come in, even with a creatinine of 20, if they're given the right fluids and they didn't develop kidney failure, their creatinine is almost normal within 24 hours. And so determining whether or not it was decompressive cystocentesis or other things, I think we need to look sooner. And of course, they looked later. I'll go back. So what they looked at 8 and 12 hours and 24 hours. Again, what that does is that dilutes out the effect and adds more variables in terms of how you interpret the results. Let's just look at a little bit of the end of their study. They did have a lot of limitations, which is really good. I think the limitation, or one of the most important ones that was missing for me, is were all cats likely to benefit from bladder decompressive cystocentesis? Meaning, although we recommend decompressive cystocentesis, if we're using it for the reasons that were outlined in the study, we should only choose cats who have the abnormality that they're either in pain or it is causing metabolic derangements, or we're going to retrograde flush where we occlude the distal urethra. But nowhere in this study was bladder size or was bladder over distension really talked about. So I thought that was interesting that we had a whole study talking about decompressive cystocentesis, but what the authors never did was really talk about bladder size. Again, they did talk about it indirectly by looking at the volume that they removed, but not those things. Let's summarize some of this paper to give ourselves some time to comment. So I'm glad it's only going to take me about a half hour. Our big theme was that study 1, performing decompressive cystocentesis, was found to improve the ease of catheterization and the time of placement. I thought the study was improperly designed and could not answer this question at all. And the reason why is bladder size was not correlated with outcome, that they had an illogical design, that primary method of unobstruction would not have been affected by bladder fullness, which means if you're just going to pass a catheter through the urethra, I asked several physicists, they couldn't come up with an actual physical law, but they did say logically it wouldn't make sense that it didn't, that it would only, if you're just going to pass a catheter, it would only be the intraluminal pressure in the urethra. The other thing is that the influencing variables were not controlled for the flushing method, the volume, or the force was really completely left out of the picture. The other thing was relieving pressures earlier within the urinary tract by performing decompressive cystocentesis did not affect resolution of metabolic arrangements. Again, my whole take on this is the study was not evaluated properly to answer these questions. Cats were not representative of the disease condition. So they were included in the assessment, if they weren't even abnormal, which to me would dilute the effect. The influencing variables were not controlled for, which was the amount of fluid replacement, which I think would really be important, as well as the amount in terms of the time it was given. And the time interval between assessments was, to me, too long to assess if there was really going to be a change if we're evaluating this abnormality. What I also want to do is go back and just talk about this paper, because this is actually very recent. It must have come out in the last 1 or 2 months. I don't know that this person is online, but I actually emailed the author of this paper to ask what they thought about it, now that I think that their impression was much different from mine. They had several things. When cystocentesis is performed carefully by experienced clinicians, there appears to be minimal risk for significant bladder leakage or rupture in cats with urethral obstruction. I thought that was interesting because this was a take-home message, but it was not even evaluated in the study. In fact, what that study did mention is it said urinary bladder rupture secondary to urethral catheterization was low at 1%. And then in one cat in the decompressive group, had a urethral tear. And what they really recommended, and of course you don't get a tear from doing decompressive cystocentesis, you get a tear from passing the catheter. And actually one of the author's recommendations is owners should be warned of these rare effects of urethral catheterization. So that sort of was left out. So I thought that the person who reviewed this was actually very biased. Number two, although decompressive cystocentesis appears safe, I think you already know the answer to this. It didn't influence the outcome in terms of ease of catheterization. Again, I feel that the study was illogically designed and inadequately described, and therefore could not answer this question. The outcome measure does not address the hypothesis or the conclusion. And the last one, again, we've gone through as well, is that decompressive cystocentesis had no significant value in improving metabolic derangements or clinical outcomes. Again, I felt that no conclusion could be made because the study groups included cats that were metabolically normal. I guess after reading this entire study and going through the other studies that talked about this test, the important message that I really got, and that's because I had a wonderful advisor, and that is that there's a big difference between unanswered questions and unquestioned answers. We need to be careful not to be blinded by data just because it's published. I'm going to stop there, but I'm going to give the opportunity for us to discuss this paper or what you think about it. What I don't want to do is I don't want to present just my ideas of this paper. I would be curious to know if you thought that I was too harsh or not logical. Evidently, there were reviewers for this paper, and so they must have disagreed with me as well. And so I would be curious to see how this group feels about this paper. And when you read it, what did you think about? Any comments or questions about this paper?
Do you know if there were any urologists involved, or was all from the emergency field?
I think they were all from the emergency field. So you're right. I don't think so. Most of them, I think, were emergency names. If you want to, you can pull up that paper, or what I can do is I can go to the front of it and maybe I list their names. So there are their names right there. Great. So those are the names. And I don't know, do you identify any urologists on there?
No, I don't.
I don't either. Any other comments or questions? Am I being overly critical of this paper? Because I can tell you a lot of people bring me this paper and say, Jody, did you see this? See, we don't have to keep doing decompressive cystocentesis. And I'm not sure that that paper answers these questions, but I do, and so maybe it's an important question to bring up. And I don't think we need to do decompressive cystocentesis in every cat. Certainly, and it depends upon what you're trying to do. If you need a good sample for culture and urinalysis, and the cat is stable enough, the answer is yes, you should do it. But if you have a cat who doesn't have a very big bladder, and your method of unobstructing, even if it requires some retrograde flushing, as long as you get appropriate anesthesia and anesthetize the cat, I don't think you really need to do a decompressive cystocentesis if you're not interested in those other questions. But certainly we should evaluate the patient for whether or not it's needed or not. I mean, my biggest reasons is I want a good sample and I want to minimize the pain going on in my cat, and I want to start correction of those metabolic abnormalities so that my cat doesn't develop acute kidney failure. So I want that kidney to start working, and I want the bladder to sort of heal as quickly as possible. So those are the reasons why I do it, but certainly I do it more often in cats who have very big bladders and are metabolically deranged. Other questions or comments?
I would make. Go ahead.
Oh, please, Larry, you first.
I was just going to say, I think the paper neither supports nor rejects the idea that decompressive cysto is useful. And I agree with a number of the points that you made. But having said that, I don't come in the middle of the night and unobstruct cats anymore. My emergency department does that, and regardless of what I say, they're going to do it the way they want. So I have minimal influence in how it happens here, and I think that's probably true of many of us. My other comment, and I'll be brief because I got to go do a sub, is that well, never mind. Well, I guess what I was going to say, Jody, you've probably had this experience lecturing in Europe. There are some very strong opinions in parts of Europe where they're like, absolutely, you should never do this. It's malpractice. The bladder's going to rupture. My experience is that the ones that are going to rupture whether you flush the urethra and put more pressure on it by flushing retrograde, or whether you do a decompressive. I think those cats that are toast are often the ones that have had chronic partial urethral obstruction from a stone, and the bladder's already gotten to the point that it's going to fall apart no matter what you do. So that was my other comment.
Yeah, I agree as well. We've gotten better and more safe in the way we do decompressive cystocentesis. But I agree with you. Those are probably in trouble anyway. And in fact, we've had cats who ruptured their bladder because they flushed the bladder, which tells me that bladder would have probably ruptured anyway. So I agree.
My first, I guess, put this out there. I'm firmly on the ECC side. I'm a criticalist, so I'll make sure I'm admitting my bias ahead of time for that. But I quite agree with all of your points and critiques of the study. Those all made sense, and I appreciate you kind of going through that and sharing it with us. I think from a perspective of the folks kind of in the hot seat doing some of these procedures and unblocking these guys at different hours, there's been a little bit of this age-old debate of whether or not a decompressive cysto is safe, not whether or not it achieves some benefit in the process. And so for a good number of us, I think this study is quoted as one that said, well, there didn't seem to be a higher risk of bladder rupture with a decompressive cysto. And maybe that's not one of their conclusions, and maybe it's kind of a false, I guess, finding that we've taken from that. But that's one thing that we kind of do borrow from this particular study, because but prior to this, there's kind of folks on either side of that line that would never put a needle anywhere near a bladder, similar to the European folk, and others that were firm believers in it for practical reasons. In a teaching hospital like we are, it takes some time to get the cat anesthetized enough or stable enough, or get all the equipment together. We're dealing with students and interns and folks that are at variable experience levels, and there's other emergencies coming through the door on top of this one. So there's sometimes a delay to actually getting to the unblocking part of things, and this is a little seen as a little bit of a bridge towards at least providing what I call a moment to take a breath to get to that point if it's needed. And I agree with you. Not every cat needs this by any means. It's just a tool in the toolbox.
Yeah, I agree as well. It's not a one thing or all. It's just I was surprised at the paper because they mentioned certain things that this paper didn't prove. Like they said, instead of performing a decompressive cystocentesis, you should manage your electrolyte abnormalities by counteracting the effects. And the reason why is because cystocentesis doesn't help. But that was to me, another misinterpretation of the paper in terms of bringing it out. But you're right. I think we need better studies and to think about what we're actually saying in terms of what it shows, and it needs to be, make sure that our conclusions um, match our results. So that was all. But I was just surprised that it has been how can I say, re-put out there in the communication world about this paper without looking critically at at whether or not it even makes sense in terms of how they evaluated the results. But I agree. Well, if there are no other comments, I think I can relinquish my screen. The good news is that we're done early. I just thought if you had a lot of these questions coming to you, that you would get the same thing that I would. So I'm going to stop sharing. JD, I guess I'll let you in the journal club however you want to.
Okay, well, thanks. That was fantastic. Thank you so much for leading this. That was a great discussion. I thanks everyone for coming as well too. Look forward to having everyone join the next session. Check out your email forum. You'll see some emails coming out from me later on the day, just as a reminder of asking people to sign up for the next one, as well as information on hosting this recording. But thank you, everybody. Hope everyone has a great weekend, great rest of the day, and certainly thanks, Dr. Lewis. Wonderful presentation. Really appreciate it.
Certainly welcome. Thanks, everyone, as well. Bye-bye now.